Okay, so today we are going to be palpating certain structures of the knee. I'm going to start first with the tibial tuberosity of her right knee, right here. So I start down with, I feel for the patella first, come down the patellar tendon, keep going until I feel this bump, this ridge right here, and that's going to be the tibial tuberosity. The next I'm going to palpate the tibial plateau. So I like to start again by the patella, come down, and then open up my fingers medial and laterally until I feel two ridges right here. And so I would call this the proximal tibial plateau. This ridge, this just line right here above the tibial tuberosity. Next, I'm going to palpate the quadricep tendon. So I'm gonna have her first extend the knee. Okay, I'm going to feel for above the patella. Okay, and I'm going to have her bring it down, and it should feel like cord-like structure right here, right above, which goes over the patella and turns into the tibial, the patellar tendon. Next, I'm going to palpate the IT band. So go ahead and lie on your side, or lie on your back. Good. Now the IT band originates at the gluteus maximus and the TFL and runs down the lateral side of the thigh to stabilize the lateral side of the knee, and inserts at the lateral, oh, you can't see, at the lateral femur, patella, and Gertie's tubercle. So usually you could find this and differentiate it between the vastus lateralis, because the IT band is going to be like a very taut structure in feeling. So I would say it's right here. You okay?
Yeah.
And usually this is sometimes sensitive for some patients. So like I said, the difference would be with feeling for a muscle and then coming down a little bit right next to the vastus lateralis and feeling for a cord-like structure. And lastly, I'm going to palpate the biceps femoris. So go ahead and bend your knee. Okay. So the biceps femoris, the long head, originates at the ischial tuberosity, and the short head originates at the linea aspera. The long head is more superficial than the short, but they both are attaching at the fibular head. And one way to find this is to have the patient flex isometrically, and their biceps femoris will be on the lateral side, and you will feel this, again, a cord-like structure right here. So you feel that?
Mm-hmm.
Okay, so again, I had her isometrically contract her hamstring. So go ahead and contract, like bend your knee, but don't move. Good. And you can immediately feel the distal end of the biceps femoral tendon right here, and it will be attaching right here to the fibular head.